That's not the right question, unfortunately. It has to be all of these measures together. It has to be. Testing alone does not work. Contact tracing alone does not work. Lockdowns alone do not work. It has to be part of a comprehensive strategy. Testing needs to be strategic. It can't be testing every single person in the population. It's just not feasible. It's just not possible. We have tried to be very clear in our testing strategy and prioritizing your tests for suspect cases, testing suspect cases and contacts who develop symptoms. That's the priority. In situations where testing may become challenging because the tests aren't available or the reagents aren't available or the swabs are not available, then you need to be more strategic, even more strategic, and maybe focus on those individuals who may develop severe disease and require care. Maybe focusing on more intensively on healthcare workers. And so it's a much long-winded answer because it's complicated. It depends on the situation that you're in, but it has to be a series of measures that are put in place. It cannot be one situation, one measure alone. The DG has said not testing alone, not contact tracing alone, not isolation alone, not quarantine alone, not lockdown alone, all of these measures. Physical distancing is important, hand hygiene is important, respiratory etiquette is always important. So it's all of these measures that need to be considered when either intensifying them or lifting them.
Just supplement very quickly, and from the perspective of the situation in Mexico, there have been 16,752 cases in Mexico as of yesterday, with 1,569 deaths. But the number of cases is up 76% by week on week, and up 80. The number of deaths is up 83%. So there's no question that in the case of Mexico, this is still a very active epidemic in Mexico. I don't have at hand, obviously, the subnational data, so I won't speak to the different patterns that may be occurring at the state level. When you calculate a crude case fatality of those confirmed cases and deaths, that case fatality is of the order of 9%. And that can mean a number of things, but what it usually means at this stage in an epidemic is that there's under-detection of the milder cases. That's what we see in many situations, a higher case fatality, and then as you test more people and you detect more mild cases, that proportion drops over time. It can also reflect, and has reflected, as you've seen around the world, that when the health system comes under pressure and intensive care beds come under pressure, patient outcomes can be affected by the lack of oxygen or the lack of availability of ventilators, etc. So I would say that Mexico is like many countries in Central and South America, is on an increasing trend. More needs to be done in terms of surveillance, testing, and obviously our regional office for the Americas, the Pan American Health Organization, is working very closely with authorities in Mexico to support them in improving surveillance and improving patient outcomes. And I know that Mexico has at least 9 registered trials for clinical trials, and also has shown interest or has requested to be part of our solidarity trial. So we thank Mexico for that. We thank Mexico for its openness and data sharing, and we will do all that we can at WHO and at PAHO to support their response, because right now the situation in Mexico is still evolving, still developing, and obviously more needs to be done to bring the disease under control.
Thank you very much, Dr. Bunker-Corbin. Dr. Ryan, next question is coming from Malaysia.